ওকে, আচ্ছা আমি ফার্স্ট থেকে শুরু করছি, আমার লাইভ স্ট্রিমটা শুরু ছিল না বলে তাই। ওকে, good afternoon all of you. Chronic obstructive pulmonary disease, COPD. The introduction of COPD. COPD is a chronic lung disease characterized by the airflow limitation that is often preventable and treatable but not curable. It includes emphysema and a chronic bronchitis. Emphysema is defined as an abnormal permanent enlargement of air spaces distals to the terminal bronchioles with a destruction of the alveolar walls and without obvious fibrosis. Chronic bronchitis is defined as condition associated with the excessive tracheobronchial mucus production sufficient to cause cough with expectoration on most days for at least 3 months a year for more than 2 consecutive years. COPD is mainly caused by smoking, while asthma is mainly caused by the allergens. Okay, তো সিওপিডি তোমাদের মেন জিনিসটা যেটা হলো যে সিওপিডি যেটি যে এয়ার ফ্লো যে ট্র্যাক রয়েছে তোমাদের রেসপিরেটরি সিস্টেমে, সেখানে যদি তোমার এনলার্জমেন্ট হয়ে যায় বা সেটার যদি নর্মাল থেকে যদি ছোট হয়ে যায়, তাহলেই কিন্তু তোমার সিওপিডি হওয়ার সম্ভাবনাটা অনেক বেশি থাকে। ঠিক আছে, সেটা হচ্ছে অ্যাবনর্মাল এয়ার ফ্লো সিস্টেম, সেটাকেই বলা হচ্ছে সিওপিডি। নেক্সট আসছি etiophagogenesis of COPD. The main cause of COPD is smoking. Non-smoker can get a COPD too. Characteristics of COPD start after the age of 40. Breathing in breathing in smoking and chemical can trigger an inflammatory responses in airways and alveoli and can injure them. This may lead to the COPD. The inflammation of COPD increases as decreases severity increases. In advanced COPD, inflammation does not resolve completely despite smoking cessation. The chronic inflammation in COPD does not seem to respond in corticosteroids. The risk factor for COPD includes smoking, active or passive, smoke from biomass, fuel, firewood, burnt plastic, exposure to air pollution, working with chemicals, dust, and fumes. Always hyper-responsive include asthma, a history of childhood respiratory infection, the previous tuberculosis, hereditary deficiency of alpha 1 antitrypsin, smoking during pregnancy can put the fetus at risk, low socioeconomic status. So these are the etiophagogenesis of COPD. Clinical manifestation of COPD, shortness of breath, especially during the physical activities, are wheezing. Chest tightness, chronic cough, frequent respiratory infection, fatigue. Cyanosis, ominous sign, unintended weight loss in larger steps, swelling in ankles, feet, or legs, sittings and bending towards with hands on knees, tripod positions, pulses, deep breathing, forced expiratory time, barrel chest, hyperresonant chest, diminished breath sound, bronchi, and spirometry shallow obstruction. Okay, so these are the clinical manifestation of COPD. Next, it is the management of COPD. So, what is the management goals for the therapy of involved are prevention and control of the symptoms, reduction of the frequency and severity of exacerbation, reduction of frequency, improve of health status, improvement of exercise tolerance. So these are the management of COPD. Next is non-pharmacological management of COPD. Quit smoking, reduces the rate of decline in lung function, rehabilitation, exercise, nutrition, and education. So these are the non-pharmacological management of COPD. Next, we come to the pharmacological management of COPD. Oxygen therapy, antibiotics such as azithromycin, benzyl penicillin, ampicillin are required as the infection Often participate acute attacks. Bronchodilator, inhaled bronchodilator. Inhaled bronchodilator are preferred to be the oral formulation due to their better efficacy and lesser side effect. Short-acting beta agonist, salbutamol 1 to 2 puffs 3 times a day, tarbutine 1.5 mg 3 times a day. Long-acting beta agonist and 1 to 2 puffs twice a day. Short-acting anticholinergics 1 to 2 puffs 2 to 3 times a day. Long-acting anticholinergic 1 to 2 puffs once a day. And methylxanthines injection amino aminophylline 250 mg in 500 ml of 5% so slowly over 8 to 10 hours in acute attack. Tablet theophylline 100 to 300 mg 3 times a day. So side effects of theophylline, tachycardia, nausea, arrhythmias, and convulsion. These are the side effects. Next is glucocorticosteroids. Inhaled corticosteroids. This should be given in severe COPD or in those with repeated exacerbation. Fluticasone 1 to 2 puff twice a day. Budesonide 1 to 2 puff twice a day. Next is systemic corticosteroid. This should be given only in patient with the acute exacerbation of COPD. Tab prednisolone 30 to 40 mg per day for 8 to 10 days in tampering doses. Okay, so thank you. This is the COPD. Next, we will start the introguide system in the next class. So this is all for now. Thank you very much.